Today's topic: why is healthcare so expensive? If the answer were easy, we wouldn't be having this discussion. Here's how it breaks down. The first reason: prescription drugs, the fastest growing health expense in the country. Drug companies claim they need to charge so much for drugs because they need to make up high research and development costs. How much? About 15 cents of every healthcare dollar spent. Moving to generics is an option that could save nearly $25 billion a year. Reason 2 is what some people call defensive medicine and other people call covering your rear. In order to protect themselves from lawsuits, doctors have to pay enormous malpractice insurance premiums. They also have to perform tests, and more tests on their patients. What's more, some patients will request even more tests than they need since they aren't paying out-of-pocket costs for them. However, since health insurance companies are paying for these tests, everyone's costs go up. It's a complex problem, but it's not insurmountable. By supporting reforms to the malpractice system, we can all work to lower these costs. Speaking of costs, let's see that dollar again. Defensive medicine makes up 10 cents. And while defensive medicine is expensive, so are the raw costs of providing patient care. In fact, services in outpatient hospitals and freestanding clinics have been growing rapidly in part due to the practice of defensive medicine. Add that to hospital price increases over and above the cost of inflation, and hospital services total 35 cents of that dollar. Another factor in health costs is administration. No surprise there. Healthcare is a complex business, and the paperwork and processing can be expensive. We all have to bear the expense of an inefficient system, government regulations, and investing in healthcare information technology. On our dollar bill, administration fees would amount to 11 cents. On top of that, the health coverage industry gets 3 cents of that dollar. The next reason is the one we can do the most about. We simply have to take better care of ourselves. Many of us lead lifestyles that are unhealthy. By taking charge of our lives and taking better care of ourselves, we can lead longer, healthier lives and spend less on healthcare. A few simple things you can do include: get 8 hours of sleep a night, eat healthier, stop smoking, cut down or eliminate alcohol consumption, and exercise. Of course, we can't anticipate all unexpected health events like injuries. However, waiting until you're sick to go to the doctor just means you'll have to spend more money on tests and pills to get better. If you make your doctor an ongoing part of your health routine, you can stay ahead of the game, live healthier, and head off most diseases before they get serious. But since we don't, those doctor's fees cost us all about 26 cents of that dollar. So, to sum it up, we pay higher costs because of prescription drug costs, doctors protecting themselves from lawsuits, hospital, insurance industry, and administration costs, and folks just not taking care of themselves. We could pay less if the system were more efficient, we used generic drugs, and took a more active approach to our health. These are complex problems with no one-size-fits-all solution. However, there is light at the end of the tunnel. As health insurers work with physicians and patients to reduce costs, waste, and paperwork, and changes work their way into the system, costs will come down. Now you know. Until next time, stay smart and stay healthy.